products claim that for all skin types, but the truth is no product is for one size fits all.
For people with darker skin tones, finding the right product can be a little tricky. Aesthetic nurse and clinical director of the FEW Institute, Shay Moinuddin, joins us now with some solutions. Welcome back.
Thank you so much for having me.
Thank you, thank you.
Yeah, because there's so many things you see products to say, for any skin tone.
And that's not necessarily true.
Right.
So, I mean, thankfully, as time has evolved, I mean, I've been in this industry for a very long time, almost 20 years. Laser technology is involved, skincare is evolved. So we're kind of getting where we need to be. We're not there quite yet, but it's getting better.
Probably that's why you need to see a professional because they know what works best. Because with darker skin tones, you end up with, say, scars.
Yes.
Keloids, and it just doesn't give you what you want.
Yeah, and the biggest thing is, especially when we're doing cosmetic treatments, we don't want to ever make things worse, right? So like if someone's walking in the door and they're looking for improvement, we never want to create a complication. And so that's why it's really important that you know where you're going, what their experience level is, and how often do they treat darker skin types.
Okay. So what's the first thing you got for us?
So this first treatment, this Epicutis ABT treatment, one of the common complaints I get with patients who have darker skin is that they suffer from hyperpigmentation. So even if they get a little minor cut or acne, it leaves a dark spot that can last for months. So this is a brightening treatment. It's created with this botanical extract that comes from flower. It's a burdock root, and it helps to really brighten the skin naturally. It's environmental working group verified. So it's very, very clean, no preservatives, no chemicals, a great way to naturally brighten the skin.
Yeah, because I also saw some pictures of people with redness. It was really good with redness,
it helps to decrease redness.
Okay, so which is the before and which is the after?
So the first one's the before and the second one's the after. So sometimes on this screen it's hard to see,
from here,
but it really does help to brighten the skin, especially for darker skin patients.
Because I'm so fair, I don't know, but because you also have to be careful if you have dark spots, you can't, and you're trying to correct those, you can't get the skin around it because then you're causing other problems, right?
Well, you can sometimes create a little bit of a halo effect. So you want to just make sure that, even application is important, but this won't necessarily bleach skin, abnormally. It'll just help to lighten up the superficial dark pigment.
Got it.
All right. Yeah. And you say lasers are now being made for people with darker tones.
The biggest thing that we worry about with lasers are burning patients who have darker skin because they have more melanin in their skin. They're so sensitive to heat and they're more susceptible to complications. So, the best laser treatment for darker skin types is using a non-ablative fractional laser because those lasers are actually attracted to water, not pigment in the skin. So they're safe for the even darkest of dark skin types. They help to erase fine lines and wrinkles. They help to decrease melasma, sun damage. Really, really safe. Most patients need between 1 to 3 treatments to see the best results. So that's kind of the gold standard for dark skin. And, again, I've been in this industry for a very long time and I've seen my fair share of complications with lasers. So it's really important that you ask a lot of questions as a patient, as a consumer, make sure that they have lasers that are approved for your skin type, and make sure that their staff is trained because not every laser is created equal, and not every provider is trained the same way too. So
so Moxie, that's a laser.
That is a laser. Yes.
Okay. All right. Well, how about the one next to it?
So chemical peels. Chemical peels. That's another thing. Patients who have darker skin types tend to have more oily skin, acneic skin. So the best way to get really youthful looking skin is to have regular exfoliation.
So remove a layer.
Remove the dead skin. And so these chemical peels actually that are fortified with natural ingredients like glutathione. They help to exfoliate the skin. They help to brighten the skin. And it's a really good way for patients who have darker skin that may not necessarily be able to do aggressive lasers to get a good exfoliation.
Yeah, because when I was having my acne treatments, I remember there was an alpha acid and a beta.
They're all kind of an alpha hydroxy family of acids, but the best way to get exfoliation for patients who have acne is using salicylic acid products. So it's an oil-soluble acid. So again, whoever the esthetician is that's doing these treatments really has to understand the family of acids and what does what.
Okay. Yeah. So you also brought Dysport, which is a neurotoxin.
Yeah, it's a neurotoxin. And so kind of, the new data that came out from the American Society of Facial Plastic Surgery is saying that more and more patients who have African American skin are actually participating in cosmetic injections. The number has gone up, especially with Botox, and even with men. African American men are having more Botox injections. So I think, the premise is that we're seeing more diverse representation on social media, which I think is important. I mean, before, years ago, all we would see is maybe Caucasian patients that were doing these treatments, and now it's kind of a variety of skin types, all colors of the rainbow, and it's really reflecting in our industry, especially right now.
And what does the neurotoxin do?
Well, that's actually a chemical peel, believe it or not. That's actually a topical chemical peel, but neurotoxins actually help to erase wrinkles. So they're like your Botox, Dysport, Xeomin. They help to reduce wrinkles, and that's a colorblind treatment, so anyone can have it.
Anyone can
Okay,
do that.
fantastic. And then this final here from Dr. Few himself.
Yes, Dr. Fuse. So this is the tinted sunscreen. It's so nice because one thing is there's a misconception that dark patients don't need to wear sunscreen, and that's false. So, and I'm constantly telling my patients who have darker skin types that they have to wear sunscreen because even though we have extra melanin in our skin, it doesn't necessarily protect us from sunburns or skin cancers or sun damage. And, you know, it may take us longer to burn, but we can still get sunburn. So this is a great product because it uses zinc oxide, but it's tinted, so it just blends in really naturally with the skin. You don't get that white opaque cast. It almost acts like a BB cream. It's a really elegant treatment, and this just won Allure Magazine's Best of Beauty Award this year, which is a big thing to get. So this is out of Chicago.
Oh,
And
fantastic.
reapply, not just once a day. Reapply.
No, you have to reapply, especially in the summer. If you're outside, you have to reapply.
All right, Shay,
Fantastic,
thank you.
Shay. Thank you so much. You can follow Shay on social media. You can see your handles right there, and thefewinstitute.com.